Hey y'all, I'm Dr. Ruth Roberts, the creator of the original Crock-Pot diet, and coming live to you from beautiful Fletcher, North Carolina, just outside of Asheville. And I gotta say, it is a welcome retreat from the heat of the low country of Charleston, South Carolina. So we've all been enjoying it very much, taking lots of walks and enjoying the relative coolness here compared to home. So I had a question from Lee, who's a cat breeder, and from what she's telling me, she does this in the best way possible. And she's interested in purchasing a new queen, which interestingly enough, all cats are queens, right? All the females, they're all princesses, but that's actually what you call a female cat that's going to be used to breed or to reproduce kittens. So it's kind of interesting the names that they come up with. So you get the Toms and the Queens together, and then you get kittens. But I'm not sure why the Toms didn't get a more elegant name along with the female cats. But at any rate, she's interested in purchasing a new queen, but she was told that she had chlamydia, which is an upper respiratory disease, but was treated for it. And so she wonders if this is going to make her be a carrier for it or make her contagious, or will the treatment have put her in the clear of having any additional issues or spreading something nasty into her cattery. And so the chlamydia is actually a bacterial infection, and part of what many veterinarians will vaccinate against when they're vaccinating against upper respiratory complex in cats. In the American Association of Feline Practitioners vaccine protocol, it's considered to be a non-core vaccine, meaning that most cats are not exposed to it, but obviously Lee's got a very different situation from most folks. The ones that we are most concerned with for pet cats are Calicivirus and Herpes virus. Those are the two viruses that tend to stick around and also to come back and create problems later in life. Most of the symptoms are that of kind of a nasty cold, as far as sneezing and runny eyes and gooey gook coming out of their eyes and squinty, and they just really feel cruddy with this when they're sick. The problem is that for those two viruses, they can recrudesce or come back, just as herpes virus can in people. And so you may get the same level of severity of symptoms again, or you may see just sort of runny eyes and maybe feeling a little bit off. So one of our cats, Elsa, had some sort of an upper respiratory infection when she was kitten, and it took her about 18 months to really shake off the worst of it. And she still has kind of a runny eye every now and again. So for that reason, there's a couple of things we do that I'll talk about a little bit later that help prevent her from having really yucky symptoms. So back to Lee's issue. Unfortunately, it can be one of these things that the cat can go into either a carrier state or be contagious to other cats if the treatment wasn't for long enough. So again, because this is a bacterial infection and not a viral infection, antibiotics are often used to help treat the disease, and in this case Clavamox is apparently the best choice. Azithromycin can be used, but often does not lead to complete clearing of the infection. And it is suggested that the Clavamox be used for an entire 28 days to treat the infection and make sure that it is completely resolved. So most of the time, I would say that most veterinarians aren't aware that you need to treat for an entire month. So I've got some folks filtering in, and glad to see Lisa. So the difficulty with chlamydia is A, making sure that it's been treated adequately, and then B, if it hasn't been, then it gets a little bit difficult as far as knowing whether this cat will still be contagious or not, and also whether the symptoms come back. And so there's a couple of things that Lee could consider if this cat she's considering purchasing has not been treated for an adequate amount of time. One is to, to make sure that the cat gets treated for a full 28 days. And if the treatment was started some time ago and then there's been a month interlude, then that's difficult to know kind of how long or how much. The other option would be to focus on improving immune system function so that the bacterial infection gets taken better under control. And that's probably a better option in this situation and a good option in general, simply because introducing a cat to another group of cats is stressful for everybody, all in of its own. So that's where, again, probiotics are extremely helpful because they help put the immune system back into good working order. And then using things like thuja to help detoxify. So we'll typically use that post-vaccination, but this is a situation where you might consider using thuja for 21 days. And again, the dose for that, if you get the full tincture, is a drop per 10 pounds twice daily for in this case, 21 days. Normally after vaccines, we use it for 5 days, so it seems to be very helpful there. And then the other thing is to just make sure that the diet is top-notch so that, their immune system and their GI system is not spending too much energy just dealing with what they're eating. So obviously I'd tell you the original crock-pot diet would be optimal here. And then certainly if that's just not an option, then good quality canned foods that are low in carbohydrates, higher in protein and fats, which is what cats actually need, would be optimal here. Now, for the rest of us, this is a good example. Chlamydial infection is a good example of what do we really need to vaccinate our cats for? And do we need to vaccinate kittens for this? And so again, as I said, Lee's situation is a little bit different because she has a cattery and she's being a responsible cat breeder and trying to make sure that her animals are all in very good health and that they don't bring in diseases or spread diseases that are going to haunt these guys for the rest of their lives. So for her, that's where chlamydia vaccine makes sense, because this is something her cats are all at risk to develop. For the average pet owner, like me, I mean, my kitties don't go anywhere. Although we're trying to teach Pepe how to walk on a leash and ride in the car, which has had some humorous episodes, but he's getting more believing in this. This is not a necessary vaccine. So again, this idea between core and non-core vaccines, and using things like the American Association of Feline Practitioners guidelines to help you decide what is important for your personal pet. And it's also good to help give you information so that you can have a good conversation with your veterinarian about what is or is not important. And again, for most of these viruses, once the cat has had sort of kitten series or has had an initial vaccine, this is where titers or blood tests come in and play a terrific role, because they let you know how well your pet is or is not protected against a specific vaccine. So that's a really important thing to look at what your cats are exposed to. Do they go to boarding kennels? Do they go into situations like cat shows where there's a ton of different animals coming in and out that may be carrying diseases that they haven't been exposed to? Now, the other part of this is for us just regular old cat folks. The two viruses we worry about, again, are Calicivirus and Herpes virus, because unfortunately they have the propensity to come back. And often, especially with Calicivirus and, interestingly, feline immunodeficiency virus, the symptoms are often related to dental disease, strangely enough. And so for these kitties, they end up getting these gum line lesions, what we used to call caries or cavities, and they're not true cavities. But what happens is these viruses, for some reason, activate the odontoblasts, which are the little cells that keep remodeling your bone and your teeth to help keep the enamel in place and, you know, help repair any damage and things of that nature. But what these viruses do to the odontoblasts is they actually cause them to eat away at the enamel just below the gum line. And so these poor kitties come in with just screaming red, angry gums. And, you know, we get the gums calmed down and get them under anesthesia to clean their mouths up, and then find there's 2, 3, 4 teeth that are just horrible shape. The crown has basically been undermined below the gum where it's not visible, and in many cases when we're probing the mouth to see if there's a pocket in the gum or, you know, things of that nature, the crown just fractures off, which is awful. And these, you know, this can't have been comfortable, and yet here's these poor kitties that have been living with it for, you know, weeks and months and sometimes years. And so this is the really frustrating thing. One of the things that has been helpful to control the symptoms and the outbreaks or recrudescences of these two viruses is lysine. And so for people that have herpes virus of various flavors, whether that's just the cold sores or something more serious, lysine helps to prevent those outbreaks or recrudescences. Same thing in kitties. There's tons of preparations available, the least expensive of which is a lysine powder you can add to the top of your kitty's food. And the dose is about 500 milligrams a day. And as I mentioned, one of our cats, Elsa, had an upper respiratory infection when she was a kitten. And what we've been able to do is continue to use lysine on a daily basis. And thankfully, she has had no dental issues. And I think it's because we've been able to keep that virus under control. Now, she does have one eye that does water, but if she's on lysine on a regular basis, it's not all gunky and nasty and squinty and uncomfortable for her. So that's just, unfortunately, a rotten hand of cards she got dealt as a young kitten. But I think we've been able to prevent more serious infections that way. So that's a great thing to get. There are also, one of the trade name products is Inysyl, starts with an EINSYL, I believe, and it's a flavored lysine essentially. But if your cat is a chow hound, often you can get them to just eat the powdered lysine on top of canned food or cooked food. And that's what Elsa does. She just plows right into it, doesn't even know it's there. So that's one thing you can do to help protect your cat if it has already gotten an upper respiratory virus, and will help minimize symptoms so that they don't have as much discomfort and symptomatology, and more importantly, suffer with the disease, symptoms, outbreaks, and then also the dental disease that can come with it. Now, the other thing I mentioned was feline immunodeficiency virus. And the thing that is fascinating about that virus is that when I was finishing veterinary school in 1990, we were just getting a handle on feline leukemia, and it was awful. It was killing cats left, right, and center. It was just horrible. And it's named feline leukemia virus because that's the disease that showed up, was leukemia that was often just intractable. There was no way to treat it and prevent the disease from really taking over. Feline immunodeficiency virus showed up about the same time, so this is back in 1990. And feline immunodeficiency virus at that point was also killing cats. And, it just was bad. It was very much like HIV in humans. Once you contracted the disease, it was often just a slow, steady decline with really horrible, comorbidities or other diseases along with it. The interesting thing is that over the years, so here we are in 2017, 27 years later, feline immunodeficiency virus no longer kills cats, and most of them that do test positive for it may have more difficulty as far as other viruses coming out from under control. But these guys are living to be 12, 13, 14 with really very few symptoms other than dental disease. So that's where you really, if you do have a kitty that has FIV, you do need to pay attention to the oral disease. I'm not sure how well Lysine works in this situation, and in fact I don't think it works very well. But again, general things that you can do to improve your cat's immune function, like probiotics, like excellent diet, and supporting normal organ function with things like glandular vitamins and well-balanced multivitamins are going to be the things that really make a big difference and help minimize symptoms for these cats with FIV. Same thing across the board with Calicivirus and Herpes virus. The better shape your immune system is in, the less chance you will have of one of these viruses coming back out and creating an issue. So that's what I've got for right now. Have you guys got specific questions about these upper respiratory viruses and vaccine protocols or anything else? So I think I mentioned, several different things, and I will put a link for the American Association of Feline Practitioners vaccine guidelines, so you'll have that handy, and we'll go from there. So I'll put a blatant plea for help out. We have a cat named Moose, and Lisa's been just dealing with our sad stories about Moose, and he is a very dear boy, but he wants to beat up our girl kitties, Romy and Elsa. And unfortunately, I've tried everything, medication for him, medication for them, feel away, all of this, but he is just not making himself welcome for many reasons. And he guards the cat boxes, so they can't pee in the cat box, and so they pee elsewhere, which is delightful, as every cat owner knows. And then unfortunately, he also marks because he feels like he has to defend his territory from them. So we are trying desperately to find Moose a new home. He's a great kitty, but he does need to be an only cat. He gets along great with dogs. He gets along reasonably well with male cats, and he's not very fond of kids. He's a great indoor-outdoor cat, and he's not a cuddle bunny, but he does like to be petted and held when he's kind of relaxed. So if you know somebody that would like Moose, or you would like to see more information about Moose, email me at support@theoriginalcrockpetdiet.com, and I'll get you some more info out. And Wendy's got a question about her dog coughing once in a while, and she's usually not in contact with other dogs. And so this is the interesting thing, and Wendy, I'm sorry, I can't remember how old your dog is. So if your dog is 12 or 13 and all of a sudden it starts coughing 2 times a week, 3 times a week, panting at night, coughing more at night, I would definitely go to your veterinarian and get a chest film, just because heart disease can be very occult. And so Wendy says she's a 14-year-old female lab, and so that's right in that age range where we start to get worried. The other thing with Labradors in particular is, and for other breeds as well, is that they get a condition called, oh golly, my brains just went blank, laryngeal paralysis, there we go. And so literally what happens is the larynx is actually 2 folds that come together. So swallowing, breathing in, swallowing, breathing in, swallowing, breathing in. And so what happens with laryngeal paralysis is that one of them kind of gets stuck, or maybe both of them get stuck. So you have this situation where here's the larynx closed, maybe one's moving partially, and so what happens is you have a smaller space for air to go through, and it can create issues in that sometimes it's closed completely, but sometimes it's open. And so if it's closed, you'll hear more of a whistle when the dog is inhaling because it's drawing air across a reed, essentially. So like a clarinet, as air gets forced across the reed in the clarinet, it makes the sound. And then the other thing that can happen is if they're open all the time, they're out there, panting and running around and sucking up stuff straight down the larynx into the lungs, and so that can cause some coughing as well. The way to check for laryngeal paralysis is actually by crudely observing it under propofol, which is a very quick-acting injectable anesthetic that goes away quickly. And so that's a way to check for it. If she's been doing this since childhood, chances are good that that's not laryngeal paralysis and that's just she's snorting up stuff and it makes her cough. In particular, we can see dogs with allergies that end up coughing more. So one of our dogs, Esau, has fall allergies, and so I use quercetin and stinging nettles for him. And also he's not able to run 27,000 miles a day anymore. He can only get out on 3 or 4 short walks before his arthritis kind of creeps up on him. But using strategies like that, if you find that it's during an allergy season, help tremendously. So that's kind of where I'd start. But if the cough is increasing and you're hearing it more at night, then I would definitely get that checked out with a chest film to make sure that there's no evidence of heart disease or something else going on. So I hope that's helpful. Debbie, thanks so much for sharing the video with your friends, and I really appreciate all the shares you guys can do. We've got some exciting changes coming up on the website, and also sort of a new pricing structure for holistic total body support, so it'll be more affordable for multi-pet owners and for larger supplies. So check your email for that. If you'd like to get on our email list, go to email us at support@theoriginalcrockpetdiet.com or go to the website, theoriginalcrockpetdiet.com. There's a pop-up that will actually get you some information for free about kidney disease, and that'll get you on our email list as well. So unless you guys have got any other questions, I'm going to go back to enjoying this beautiful weather that feels like spring for us in Charleston, but it's hot for these guys here. I think it's supposed to get to 92, but I'll take the low humidity all day long. So hope that's all you guys have questions on. I'm just going to scroll back through and make sure, and yeah, looks like we've got it covered. So thank you so much for tuning in, and remember, until next week, that your pet's best health starts in the bowl. Take good care.